Imagine you have a 4-year-old patient named Johnny who has Hurler syndrome and is ventilator dependent. You live in a high-risk flood area and there are big storms coming. Have you done enough to prepare Johnny and his family for this upcoming disaster? So who exactly are children and youth with special healthcare needs? They encompass a broad group of children. They're defined as children that have or are at an increased risk for chronic physical, developmental, behavioral, or emotional conditions, and who also require health and related services of a type or amount beyond that required by children generally. So why must we consider these children in disasters? During a disaster scenario, these often chronically stressed families will have an even more difficult time accessing what they need. It is recommended that everyone have a disaster kit that includes things like food, water, flashlights, and first aid supplies. But families of children and youth with special healthcare needs need to consider having a more robust kit. They must have a backup source of energy if their child is technology dependent. They can consider having a 12-volt inverter that plugs into their car's cigarette lighter. Other families choose to purchase and maintain a generator. Another item to consider is the child's medications. It is important to have the medications placed in an easy way to grab and go in the case of a disaster. Other families are able to secure backup medications to have in the case of an emergency. So what can pediatricians address with families? It is so important to discuss disaster preparedness at office visits. Encourage families to have plans and to test those plans. You can also help create emergency information forms with families. These are paper forms that have all of the child's medical history and medications listed. That way, if they have to go to a hospital that is unfamiliar with them, or even if they have to go to a hospital that is familiar with them but does not have a functioning EMR, the majority of their medical record is right in front of you. You can also link families with disability alert registries that exist in your community. One example is the STARS program. This stands for Special Needs Tracking and Awareness Response. These voluntary registries help first responders prioritize families that might need help first. They also help first responders better understand the people that they're trying to help. For example, if they know a child involved in a fire has autism, they will better understand that he or she might be more scared of the loud noises and strange trucks outside than the actual fire. Let's go back to Johnny and his family. At his recent well check, you discussed disaster preparedness with Johnny and his family. So they went home and they made a disaster kit, had his medications ready to go, and invested in a 12-volt inverter to have as backup. So when the power went out, they were ready. And when they had to go to a hospital that was unfamiliar with Johnny, they had their information form to give to the healthcare workers there to best take care of Johnny.